Hi everyone, I'm Dr. Erin McLaughlin from the Hazeldean Family Chiropractic Clinic. What I want to talk to you about today is women and heart disease. Heart disease right now is the leading cause of death for women in Canada, with about 37,000 deaths per year, and that's compared to about 5,300 deaths per year due to breast cancer. So while a lot of women fear breast cancer, they don't actually know that heart disease is a bigger issue. It's a bigger killer for women. And I want to address the fact today that most people think the biggest risk factors for heart disease are high blood pressure and high cholesterol. But there's mounting evidence that actually points in the direction of inflammation as a bigger risk factor. So if there's chronic levels of inflammation in your body, that's actually more of a risk factor than having high blood pressure or high cholesterol. Now, there's a study that was just released this year in the Journal of the American College of Cardiology that actually studied obese people that had high levels of inflammatory proteins in their bodies, and specifically one called C-reactive protein. You're probably hearing more about that nowadays. It is coming out in the news a little more. And the study actually found that people who had triple the normal level of C-reactive protein in their bodies had an 84% increased risk of developing heart disease. Now that's compared to the more classically associated risk factors that people think, like high blood pressure, high cholesterol, obesity, excess abdominal fat. People with those risk factors have a 50% greater risk of heart disease. So you can see that inflammation is a much bigger factor than a lot of people are aware of. So what we need to be doing in order to decrease inflammation in our body and therefore decrease risk of heart disease are things like supplementing with healthy fatty acids. Those are shown to decrease inflammation. We need to be making sure we're staying away from processed foods in our diet, avoiding white sugar, white flour. You want to incorporate more vegetables into your diet. Green leafy vegetables are always good. Make sure you're being physically active every day in some form or another, having an ideal body weight. And also an important factor is to deal with stress properly. And there are a lot of different relaxation techniques, deep breathing techniques you can do in order to deal with stress better. So addressing those factors is actually going to help to reduce your risk of future heart disease, and not just simply focusing on reducing blood pressure and cholesterol.